historic that.
It is.
Yeah, it's historic because Doc now they've lowered the eligibility requiremments for the vaccinations, and anyone 40 years of age, that's still young, by the way, guys, and up can now get the vaccine. And I know that you guys over there at AMC have partnered up with Triple J to do this mobile vaccine outreach. And are you anticipating a lot of action now that we've widened the eligibility for the vaccination criteria, Doc?
Yeah, they dropped down the age eligibility to 40 just because we want to have more people vaccinated before May 1st. That's our goal, to get at least 50% of the island vaccinated. So hopefully we'll have a large turnout. I think we have enough vaccine for March and April to reach that goal. The mobile outreach program is something different. Though we basically use the van to go to either to some homebound vaccination, or we go out to reach to the indigent population or the high risk population, just like the FSM community. It's a program we offer, but again, when we go out, we will work with the mayor in each village before we go out, because that's their project. And also when we work with the FSM community, we have to make them understand that it's an FSM project, and we're just there to provide the service. So we're going to work very closely with the leadership of the FSM, and before we go out there, we're going to do a lot of education, a lot of teaching before we go out there and do the vaccination, and maybe some testing. As you know, they are the FSM community. A large part of our community that they workforce in different industry. But they probably have the least ability to access to care, to the clinic. So we're gonna bring the service to them. That's the most convenient way to assure their safety, and also to assure that we protect the community overall.
Right, Doc, I wanted to ask, because we saw, now that we're widening the eligibility criteria, we saw last month a shortage because we didn't get vaccine shipments in time. And I was just concerned, if we're widening the eligibility, that means more shots, more arms. Are we going to be able to sustain this with our current supply and any future supplies of the vaccine that we're expecting?
Public health are basically in charge of the inventory and supply. And we ask them to very carefully, do the projection and the calculation, make sure that we don't get behind like the last time. Hopefully, we would be behind. Depend on how much supply we have, but not as much as the last time, as we have like behind 8,000. But again, as long as we stay within the window of 6 weeks, we should be okay, even if you're behind 1 to 2 weeks, which are in the case of majority of people right now, but it's still within that window of acceptance, so it'll be okay.
Right on. Just real quick, Doc, what are you hearing about Johnson & Johnson? I'm just curious, with the Catholic Church coming out, it was just a lot of confusion on their part, where it's like, don't take it. If you have a choice, don't take it. And then they were like, oh, actually, go ahead and take it. Sorry.
Yeah, you'd be surprised. There's quite a few demand on the Johnson & Johnson because one shot. Yeah. So I think the message that the Catholic Church put out there, that, if you have a choice, that you can choose between the three. So they really didn't say that, you can get it. But again, as far as we hear from our patients, there's not much rejection on the Johnson & Johnson. Matter of fact, a lot of people was asking for it because it's convenience. It's just one shot. But unfortunately, we don't have that many. So the Johnson & Johnson will go out to specifically a certain population only, just because it's more convenience, and it's take a lot of time to go out to someone twice, in a month. So yeah, it's a lot. We don't hear nothing negative about Johnson & Johnson.
Right on. Okay. Anything else, Doc? Because we know you guys got to go out and get those needles. into the arms.
Yeah, we're excited. There's a lot of work to be planned ahead. Again, for the program to be successful, we're going to do a lot of education. We're going to work with the FSM community a whole lot to get out and vaccinate. Our goal is to have at least 70% of the community of FSM community vaccinated. So it's going to take some time, but we will get there.
Right on. Thank you, Doc, for coming in. You guys wave if you see the AMC vaccine van out there. Does it have a clever name? Did you come up with like a clever name? AMC
It's
Mobile.
a beautiful van. It's designed by the Triple J. So we're so happy that Mr. Joan and the Triple J team, allow us to do that and be a partner.
How many vaccines can you store in there to distribute? Is this just Moderna?
Oh, no,
Moderna and
yeah,
Johnson
we can
Johnson?
store Moderna and Pfizer and Johnson Johnson, and we have two standard small refrigerator in the van, so we can store the specimen that we do testing, and we can store the vaccine in one of them. So we kind of strip out the van and put a lot of change inside, modification. So when we roll out, we have a canopy that we attach to the van. We're going to roll it out and put some shade, and hopefully, we can provide the much needed testing and vaccination to the community.
Thank you, Doc.
You're welcome, guys. But be safe. Okay,
Yes.
get your shot.
Yeah.
And
Did you see? Did you see we had? Did you see we had Dr. McGlutney on this morning?
No.
I'll send you the link. I know you slept in today. You slept in this morning, right?
Yes.
Okay, Doc.
Okay, guys. Be
Take
safe.
it easy.
Okay. Thank you so much.
That's that.
Okay.
Dude, I like Dr. Hoa.
Yeah,
Good
yeah.
guy. Good guy. Dr. Hoa Nguyen there as they're rolling out. Roll out! Roll out! Right?
What is that other song? Riding Dirty.
Yeah. He catch me riding dirty.
No, not riding dirty, right? Riding
Riding
dirty?
vaccinated.
Yeah, riding vaccinated, not
Right.
riding dirty.
Yep. They got two refrigerators there. I don't know which one they put the lunch in, but
Gosh, jeez.
yeah. It's 8:29. Guys, we're